You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In this half-hour segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. But before we dive into my special guest today, I want to take a moment and let everyone know that we'll be broadcasting the This Just In radio show again live from the HIMSS annual conference next March in Las Vegas. Many more details to come, but I hope everyone is planning on attending and making the reservations today. We'll have another great slate of CEO, CIO, leading care providers, industry thought leaders, and certainly policymakers joining the show. For this episode, though, my 112th episode, we're going to speak with a good longtime friend of mine and local entrepreneur, Baha Zeidan, CEO and co-founder of Azalea Health. Welcome back to the show, Baha.
Thank you, Justin. I'm honored to be with you on your radio show.
Sure, and I appreciate you taking the time at your busy schedule to join us. So we caught up a few weeks ago at the Health IT Leadership Summit, and I was just excited to have you on air, hear about all the great things that are happening with Azalea. It's always awesome to come across you. Your energy, your spirit is just it's exciting. It's exhilarating. We're lucky to have you in healthcare, but also lucky to call you a friend. You bring a lot to this industry, so I'm very excited about this show.
Well, thank you. That's very kind of you, and I'm honored to be with you. And I'm always feel more energetic in your presence. So I'm excited to dive in.
Thank you, my friend. So tell us a little bit. Obviously, I know about Azalea, and you're a return guest, and I'm sure people have heard your name before in the radio show. But offer my audience a little bit background about Azalea Health and there.
Yeah, Azalea Health started in solving health IT problems with cloud solutions. We started in Valdosta, Georgia, and we built electronic health record system and revenue cycle management service to help solve a lot of the issues in the rural market. So we focused since inception on the rural and community hospitals and community providers. And in the last 8-9 years, we've been developing those cloud solutions with simple way of user-friendly way to enable the physicians and providers to adopt technology and as well as make their business better and run better and communicate better with their patients. So in simple words, Azalea Health is improving the health IT by developing cloud solutions.
Yeah, no, you guys have a fantastic reputation, a great leader in the industry. So looking out, though, at our industry, it's a very crowded field, health IT and EHRs and even revenue cycles. How do you guys differentiate your technology and innovation from the rest?
Yeah, it is a crowded environment. However, with a goal of focusing on the customer, you'll always continue to win. So we have 3 things that we constantly bring to the table to our customers, bringing them value, simplicity, and impact. And those are the things that differentiates us and make us constantly win. And even though there's a lot of vendors, the problems in the health IT still exist. We still need simple solutions out there, and we still have not cracked the nut when it comes to adoption in between adoption of technology between provider and patient. So yes, it is a crowded environment. However, if you continue to focus in providing cloud solutions that are simple and create value to your customers and improving their practices and improving and enhancing their revenue and reimbursement, you will continue to accelerate and succeed.
No, very, very true. I mean, yeah, and that's why I've always agreed and loved your strategy. And a past strategy of mine is to focus on the customer, focus on usability, focus on practical, simple solutions that they can deploy. And that's a recipe for success. So, and you guys do a great job at it.
It really is. And of course, always also about the people.
Yes.
Customers want to interact with a vendor that has top-notch team, a team that is willing to help and go above and beyond. And that's a key for our success.
Well, and I'll say that's from the CEO on down. You're one of the most personal people in health IT, and I mentioned that at the top of the show, and that transcends your entire organization. You have some of the nicest, friendliest people, but they're also experts in health IT. They're not just nice, but they're also experts in their field, and that's a recipe for success in itself.
Well, we really appreciate it. It's a tough environment. I mean, you look at the regulations, you look at the complexity of meaningful use stage 2, stage 3, you look at the complexity of the reimbursement. We need to be cognizant of this complexity and be able to help. And at the end of the day, it's our customers are people, and yes, what we provide is technology, but it has to be empowered by team that are willing to help. It's beyond technology.
I agree. I actually called it, the term that I used in my past is the white knight strategy, is really where you're helping the customer, you're kind of galvanizing in there, and you're bringing them, the solution that they need to be successful. And it's really saving them from all this pressure, all this regulation, giving them simple solutions to succeed. So,
Absolutely.
So you guys have had some great growth over the last 10 years, but I mean, tell us about your most recent growth. That's really where I like my show to focus on. I want listeners to kind of glean, well, this is how this person was successful. Maybe I can follow that same path. So where has your recent growth come from, and where has it been?
So we talked earlier on the organic growth, which is focusing on the customer and continue to deliver simple solutions and great solutions. And that always will help us with organic growth. And we've been very successful with that. However, this year in 2017, we did also 2 acquisitions. One of more of a customer acquisition. We acquired a company based in San Diego that has been around for a while, that had a very strong, solid customer base. The average customer life was over 10 years with them. So we were able to migrate that customer base on our platform and work with their team. They have a solid team. We were really honored and glad to have them part of the Azalea family. And the second acquisition was earlier in September of 2017. It was more of a strategic acquisition that enabled us to deliver what I would call our dream, which is providing one patient with one record through that continuum of care. And the last acquisition, it was an inpatient EHR with a company called Prognosis. It was based in Houston, Texas. They've been focused on the rural market as well, delivering cloud EHR for the rural hospitals. And with us being focused on the rural ambulatory side, we felt it's such a great fit to go to rural communities and healthcare communities. We'll provide them with a great inpatient and great outpatient platform and integrate that and be able to deliver it all over the web. And being able to deliver that on a cloud platform enables us to help those rural hospitals. Rural hospitals have a lot of challenges. Being in the rural market and visiting a lot of rural hospitals, it's a big struggle for them to maintain operation and as well as maintain and grow technologically. The industry pushing providers to use technology and use electronic health record and automation. However, you go to rural market, they have different struggle. The struggle is not being able to find enough insured patients. Struggle of not being able to find providers who with specialty providers that would come to those communities, and becoming harder and harder. So enabling those hospitals to use a cloud solution that is affordable has been a dream of mine for a long time. And with this acquisition, we were able to accomplish that.
Yeah, and you and I have known each other for a long time, and we've bounced this idea around for a while. It's been in your head, and for a long time to pull it together. And I've always been a huge fan of owning that continuum. If you can be so fortunate and blessed to have a great ambulatory solution, and then you can either develop or purchase, an inpatient and acute system, and then integrate those across one system, one platform, one patient record across the entire continuum. That's strong. That's the future.
And that's where actually we can be able to give better visibility on an outcome-based healthcare, because in an outcome-based healthcare, you have to see what's happening in the inpatient, and the inpatient side has to see the ambulatory side, and vice versa, and all of it being able to give access to the patient. And what we layered on top of all of that, the ability to access the patient using telehealth. So we're providing that continuum from the patient at home using telehealth and using patient engagement tools like our patient portal, then the ambulatory setting, all the way to the hospital setting.
Yeah, no, and I've always been impressed. You guys rolled out a fully integrated telehealth platform or module solution years ago, and nobody did that. You did that long before anybody else did in the EHR world or even the health IT world to this large of a platform that you have. So
we're glad to have a great team who are able to accomplish those things, but we also see the value in telehealth beyond just accessibility. It's going to be the lifesaver for rural market. And we're also fortunate in Azalea to continue to focus on reimbursement for telehealth. Telehealth is beyond the technology and adoption. It's reimbursement. We need to have a better reimbursement to enable the physicians to do more telehealth. You can't run your business if you're not getting reimbursed for the procedures that you're doing. And believe it or not, physicians want to do telehealth. It's just the reimbursement is not there, and we've been at Azalea focused on finding ways to help providers get paid for those visits and enable them with the technology as well.
Yep. No, very, very true. So, diving in one level deeper, what are some of the key factors to why organizations, ambulatory or acute, are choosing Azalea? And when I say that question, I ask that question from the perspective of what's the functionality? What are people looking for? Is it integrated telehealth? Is it really strong revenue cycle management? Is it fully integrated platform, acute ambulatory? Is it billing functionality? Is it easy to use, EHR, claims filing? What is it? What's the functionalities people are most looking for?
So, of course, if you ask different people, they will give you all of the things that you mentioned. But we're summarizing it, and after interviewing customers and after looking inside to our selves, what we're trying to provide, we provide three things that we constantly focus on, which is one, value. Being focused in rural market and being able to focus on community and small providers, it gave us that ability to speak their language and relate to them. So that's on the side of the value. Second thing is that simplicity side. Being 100% cloud environment is much easier to adopt than client server, than a massive infrastructure. We've taken customers into our platform and got them live within 30 days compared to some of our competitors who's taken them a year. So that simplicity factor is a key. And the third factor is the impact, the financial impact. We minimize the upfront impact on the physician or the hospital or rural community, and we mainly focus on reimbursement. So the impact that we bring into the provider side is very visible. So that's the side that when somebody partners with Azalea, they partner not only with a technology company, they partner with a revenue cycle management expert. And that makes a big difference. I was at a hospital just yesterday, and we're talking about the technology. They love the technology, but it always comes back to revenue. How would Azalea help me around revenue cycle management and make sure that I do not get disrupted when it comes to the revenue that's coming in the door? And those are the three key factors: value, simplicity, and the impact.
No, that's excellent. I like to keep my finger on the pulse, and so I love to ask that question of companies and their CEOs.
Yeah.
And for those just tuning in, we're speaking with Baha Zeidan, co-founder and CEO of Azalea Health. So this is another great question that I like to ask CEOs. How do you see the changes in healthcare influencing your future at Azalea, and why?
Sure. So, you and I, we're at the Health IT Summit in Atlanta, and we see a lot of great things that's needed from the health IT industry. And we're seeing a lot of great excitement around technology. And last week, I went on a tour to visit four hospitals and about 3 or 4 other clinics, and talking to our customers to see what do they need, and what do we need in the future to deliver to make their operation easier and more streamlined. And quite frankly, what I'm seeing, of course, the reimbursement is shifting to value-based and and outcome-based, and that train is never coming back. However, to accommodate that, we need better visibility, more dashboarding, more ability to make sense of the data. All of our, as vendors in the health IT, we rushed to accommodate meaningful use stage 1, stage 2, and stage 3. And we developed around standards, and we captured a lot of information, and we captured a lot of data that is required by the government, and we captured a lot of data that's needed for clinical quality measures. Now we need to focus on how to make sense of that data and how we can enable the provider, enable the staff and the team to make better decisions from this data that we've been capturing. And that's our focus in 2018, is making sure that we continue to provide excellent dashboarding, excellent reporting. And one of the other things that we also noticing that we need to go back to basics, simplifying what we have, being able to use a meaningful use system is overwhelming.
Right.
It's a lot of data capture. So how can we go back and simplify that? How can we go back and introduce mobile devices and technology that will enhance the day-to-day operation, not add another click? So we don't want to add more clicks and more features. We want to simplify what we have. And actually, one of the themes that we are focusing on in 2018 is let's simplify. Let's focus on simplicity, as we have so many screens and so many things that we want the physician and the staff to capture to meet meaningful use, to meet government requirement, to meet PQRS and MIPS and MACRA and clinical quality measures. And we want to sit back and continue to innovate around simplifying that. And of course, mobility is going to be a huge factor. We're seeing more and more millennials are some of the providers and some of the staff who are using our technology, and we have to be technologically savvy when it comes to mobile devices. So Azalea just actually, we've always had a mobile app. Now we have 2 mobile apps, one specific for provider and one specifically designed around the consumer or the patient. And we want to continue to innovate in that engagement tool and provide solutions that will enhance the experience, where within your mobile app you can charge or charts, you can document, you can actually do a telehealth visit, you can pay, you can do a lot of things right there from your phone. So one of the themes and the ideas that we want to continue to focus on in the future is just simplifying healthcare and simplifying health IT.
No, that's strong. That's excellent. Real quickly, what are some of the fastest growing markets? Obviously, you guys are really strong in the Southeast, but you've got other markets too. You've got the Southwest, but where are you guys growing the fastest? Sure.
We're growing the fastest, actually, still in the rural market and community-based healthcare, but we're growing in Texas and quite frankly nationwide. We have customers in all 50 states, and but we constantly focus on that segment of critical access hospitals, community hospitals, and small to medium physician offices. And we're growing in the areas also that where people want to innovate and ditch a complex system. We're, as you know, the majority of our new customers that are coming in, they are replacing an EMR. So they're not new to an EMR. They are ripping an old system. So they're expecting a lot more from us, which is great. And that's why we have to deliver a more simple solution, more engaging experience after signing up with Azalea. So we have to constantly bring in our customers more tools, but simpler tools, as we're seeing now and more just rip and replace. Providers did buy and rush to buy sometimes, and we're seeing many vendors, unfortunately, not being able to keep up with the technology that's required by macro and MIPS and meaningful use stage 3. So providers have to shift. Yes, it's a crowded market, but the providers who are, or the solution or the software solution providers who are providing a meaningful use cloud solution, there's not that many, and and that's where we're growing the most. We're growing with customers who are looking for a cloud solution.
No, that's excellent. Well, I see you at HIMSS 18 in Vegas.
Absolutely. We are honored to be at HIMSS and part of the Georgia Pavilion. This is I believe our 4th year. So this year is going to be more meaningful than previous years, just because we also have now inpatient solution and the ambulatory solution. So we're looking forward to connect with other CIOs of hospitals and other partners within the industry. It's always fun to learn, fun to engage with other vendors and other solution providers in the industry. And we're excited. I'll be there and I'll see you there.
Excellent. So I always ask these last 2 questions of my guests. Overall, why do you do what you do? You know, what do you hope to achieve as a chief executive of Azalea Health?
Sure. You know, that's what gives me the energy every morning, actually, is serving rural market with cloud solution. I'll tell you, when I first started in the health IT, I started in a small company working in a medical laboratory, where it was a clear evidence that there's a huge difference between health IT and financial technology. And I'm talking about the year 2000, when in 2001, when I go online and buy stocks and sell stocks online, start engaging with with online banking, and yet when I go in health IT where I worked, it's still character-based systems. It was still very expensive. It was very slow. We were actually delivering lab results in weeks, and the financial technology world were delivering, exchanging stocks in nanoseconds.
Right.
So what ticks me is wanted to help and in providing cloud solutions that is up to par with at least fintech, because the fintech's so advanced, yet we're so behind in adoption in health IT. I talk to people and ask them, how many do you use mobile banking, or do you use online banking? Everybody does, but not many engage with their clinical data online. Which one is more important, your health or your financial health? So while we are engaging with our financial health, we're not engaging with our own health. And what I want to look back and say that at Azalea, we accomplished providing cloud solutions in the rural market, and we were a huge driver in getting rural market a shot at being technologically advanced.
Love it. That's awesome. One final quick question. What is your favorite place to get or be inspired?
Well, I may have to mention two places.
Sure, quickly.
So the first place, every morning I do a quick 15 to 20-minute run. So that's my moment of
Excellent.
peace where I think and just jog, run, walk, and just prepare for the day. And and I don't listen to music when I do that. But the second place is our customers. When I go to our customers and listen to them, I get so inspired and motivated. So those are my two favorite places.
Fantastic, my friend. Both for me, to be honest. I mean, I run every other day or so, and that certainly gives me the energy, and it's very inspirational to get out there and just clear your mind and think. And sitting with your customers is a strong second for me as well. So fantastic, my friend. Baha, we're at time, but it's great to have you as a guest again, my friend.
Well, I'm honored to be with you, and I appreciate your time as well. Thanks a lot.
Thank you. And thank you to everyone for listening and joining us today. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you missed any of this episode or want to hear more, all of my radio shows are posted on Apple iTunes and SoundCloud. Also, check out the new website we've launched at justinbarnes.com. Thanks, everyone. Have a terrific week.